And those are my questions for now. Okay.
Hi, my name is Rich. I'm a level 1 student nurse.
Hello.
Hi, do you mind if I follow you today?
Yeah, sure.
Okay, can I get S-bar on your patient?
Sure. Right now I'm working with Miss Marta Yarn. She's in room 529. Her primary physician is Dr. Jolly. And she was admitted because she has a non-healing sacral ulcer. She's had it for about 3 months, and she was treated as an outpatient a couple times without success, unfortunately, so her physician sent her here to see if we can help her out with it.
Okay.
They did a culture, and they found that she has an infection of E. coli, which is gram-negative bacteria. I'm sure you've learned about it in nursing school.
Yeah, oh yes.
Yeah, so the physicians prescribed some gentamicin to help out with that. And we're also going to hang a basic infusion bag of normal saline with potassium chloride, about 20 milliequivalents in there. So, yeah, she has a history of pneumonia and occasional stress incontinence with nocturia, and she also has a history of dehydration. So those are things we're going to want to just monitor for throughout her stay. She's not a smoker. She has no chronic illnesses, and no heart defects, no heart disease. Her last round of vitals show that she is experiencing a little bit of an infection. She has a temperature of 99.1, which, as you know, is high. It's not within the expected range. Her respirations were a little bit elevated as well. It was 24. Her pulse was 88. Blood pressure, she is hypertensive. Currently, it's 144/90. And her O2 stats are a little bit lower than we'd like to see. They're 92 on room air. So we're just going to watch that as well. And if something, if it dips lower, we're going to call the physician.
Okay. So why specifically is the client receiving medication?
The gentamicin is an antibacterial, so since the culture revealed that she does have an infection of E. coli, which is a gram-negative bacteria, which is sensitive to gentamicin, we're going to give her gentamicin.
Okay.
And, I forgot to mention, we were also looking at her, your complete blood count for the labs, and her white blood cells were a little bit elevated as well. They were at 12,500.
Okay.
So that's, more evidence of an infection. So we give her antibiotics. And then as far as the potassium chloride, in the normal saline, we're giving that to her just because the potassium level on her last lab results showed a 3.6, which that's still within the expected range, but it is a little bit on the lower end. So it's more of a prophylactic reason to make sure it doesn't dip any lower.
Okay.
So that's something we're going to give to her and then monitor her throughout.
Okay. So what action do these medications have on the body?
Well, let's start with potassium and chloride. You know that those are electrolytes, and they pretty much help with the metabolism of the body. Potassium is actually the most prevalent electrolyte within the cells in the intracellular fluid, and it just helps with everything. Regulates your heart rate, respirations, all that good stuff. So that's why she's getting that. And the gentamicin, the antibacterial, that one actually, it directly affects the 30S subunit of the E. coli's ribosomes, and that stops protein synthesis. So if your bacteria isn't able to synthesize protein, it can't really reproduce, because that's kind of an important part in the reproduction process, being able to produce more of you.
Right. Okay.
So that's going to help with the infection and just sort of keep the bacteria from reproducing, and eventually it'll all die, hopefully, with the body's natural defenses.
Wonderful. Thank you so much for the information.
Yeah.
When should you question administering the medication?
Oh, my goodness. So for the normal saline with the potassium chloride in there, you're definitely going to want to make sure that she's not having any arrhythmias, her heart rate isn't too low, same with the respiration rate. Just make sure she's not, disoriented or anything like that. You're going to want to monitor her pretty close. And then for the gentamicin, you definitely want to check her labs, as I did, to make sure she's not experiencing any kidney failure. She's not allergic to the gentamicin. She doesn't have any sensitivities, because those are things that would definitely be contraindications for this particular medication.
Okay, great. Does the medication have a therapeutic serum level?
It does. Actually, just look that up. It's you have to get it within, I believe it's 8 micrograms per milliliter for the gentamicin.
Okay.
Yep.
Okay.
And then, as you know, for potassium, you want it to be between what? 3.5 and 5, right? Okay.
Great. Yes, I just learned that. Okay.
Excellent. Yeah, it's going to be on the test.
Oh, well,
that fluid
okay.
and electrolyte test, you
Oh,
probably
no.
need to remember that.
Which vital signs would you want to monitor?
All of them, because as I told you, and you probably already know, the potassium does affect, the heart rate, respiration rate, pretty much everything. And the gentamicin will have an effect on that as well. So you just want to make sure everything's functioning normally.
Okay, that kind of answers my next question, the physiological parameters that you want to monitor?
Oh, yeah, and then also with the gentamicin, you want to make sure that the patient's not experiencing any like itchiness or urine retention. So you're going to want to make sure that you're doing daily weights on her to see if she's retaining. She's going to be on strict input and output just to monitor again for the kidney failure that may occur.
Okay.
We're going to check her blood serum levels for, like BUN, everything that has to do with kidneys. And then we're also going to have her monitor herself for any signs of ototoxicity. So that'll be ringing in your ears, loss of hearing, that kind of thing.
Oh,
but
wow.
for
Okay.
her, since she already has some hearing loss, she is going to just be monitoring for the tinnitus, the ringing in the ears, and
Okay.
the vertigo.
Okay, so that kind of answers my next question. Interventions taught to the client to ensure medication is administered safely.
In the hospital setting?
In the hospital setting.
Yeah, we're going to want to make sure she knows what she's getting, why she's getting it. We're going to want to make sure she's familiar with what it looks like and how it's being given to her. So if she's used to getting an injection, we don't want someone telling her, like, oh, yeah, here, have a pill, it's the same exact thing, and her just blindly accepting that. So those are things you want to look out for. Just make sure she's willing to question it, because the client does have the right to refuse medications. So that's going to be something important to remind her of. Just make sure she's comfortable with everything that's going on.
Okay. Now, what about when she's at home?
Well, when she's at home, she's not really going to be giving herself IV infusions. So we're just going to make sure that she's familiar with signs of infection, so she knows when to call the doctor. And we're also going to want to make sure she knows when things are not right for her as far as her potassium levels are.
Okay. Okay.
So, like just monitor your respiration, heart rate, all your normal vital signs, that kind of stuff.
Okay, great. Well, those are all the questions I have right now.
Okay, cool. Well, do you want to watch me hang the IV bag?
Yes, that'd be wonderful.
Okay,
Thank you.
let's see if she's awake. All right, give me 1 second. Just going to move everything in. Hello, how are you doing today?
I'm good. How are you?
I'm doing all right. This is RT. He's a level 1 nursing student. I was just wondering if he could watch me hang your IV bags.
Yeah, that'd be fine.
Okay,
Hi,
cool.
nice
Yeah,
to meet
come
you.
in.
Hi.
You can close the curtain for privacy. So you said you're doing okay today. How's your sacrum feeling? Your ulcer? You still having pain?
No, since you gave me that pill earlier, I'm feeling a little bit better.
Okay, excellent. All right, so I'm going to go ahead and just hang your IV bag since you have a history of dehydration. We're going to go ahead and hook you up with some fluids, and then I'm going to give you some gentamicin as a piggyback infusion, and that's an antibiotic. So it's going to go ahead and help with that infection that you have.
Okay.
Yep. Okay, so we're going to pull out MR. And just verify what we're giving. Okay, so we're giving the gentamicin. Is there it is. Okay. Maybe our primaries. Want to make sure we can hang it all piggyback. Of course, as you can see, all of these lovely things are in their packages. Everything is still nice and sterile.
Okay.
Yes. Alright, and Miss Marta, you know that if your pain starts to go up again, you just hit your call light and you let me know about it, okay?
I'll do that.
Yeah, you still have some PRN meds that we can give to you, so if it starts to wear off, just let me know.
Okay.
Alright. And also, do you have any pain right now at all?
No, I would.
Not even a little bit?
Maybe, I don't know, maybe a tiny bit, but
So like on a scale of 0 to 10, 0 being no pain and 10 being the worst pain ever, how would you?
I'd say it's about a 1.
A 1? Okay.
Make sure it does 5 drops.
Okay.
0.9, so like in the back of the 0.9%. And it's with 20K started.
All right, so we're going to go ahead and start hanging bags.
Okay.
And the most important thing when you get new materials like this is that you make sure that all your clamps are closed. So it looks like they are in the bag still. I'm going to go ahead and get my gloves on and we'll start this show.
Oh, great.
Yep. Oh, and Marta, just so you know, at midnight tonight, we're going to have to put you on NPO, which means that you're not going to be allowed to have anything by mouth. So that's another reason why we're giving you the IV fluids. It's because you're not going to be able to drink anything or eat any food, because you have that surgical debridement for your sacrum tomorrow.
but that's not until midnight?
Yeah, it's not until midnight. So right now you can have whatever you want, but tomorrow morning you're not going to be able to eat it or drink anything. Okay, so we're going to go ahead and we're going to hang the sodium chloride with the potassium first. And Miss Marta, can you tell me your name and age?
I'm Marta Yarn, and I'm 80 years old.
Okay, and do you have any allergies?
No, I don't think so.
No? Okay. All right, and you're still full code, right? You haven't changed anything on me yet, have you?
No, not today.
All right, good to hear. Like having you around.
I want you to look out for.
All right, can I see your ID badge?
Again, in the IV. Swelling, any type of a rash. If you have any heart palpitations or anything like that, let me know, okay? I've also got some medication information here for you about the gentamicin that you're getting, okay? So just, can you tell me some side effects you want to look for? Burning and inflammation. Okay. And then again, heart palpitations, if you just feel off, any nausea, vomiting, okay? Okay. Here's your call light. Alright. Is there anything else before I leave? No, that's it. Thanks, sweetie. Thank you.
I almost wanted to say, I almost got it.
So, looks like everything matches. So we're going to go ahead and we're going to spike your IV.
Is there anything specific you look for with the bags?
Oh, with the bags, you're going to want to make sure that the color's correct. You want to make sure you look at it and look to see if there's any sort of cloudiness, any sort of precipitate that might be in there. You definitely don't want that, especially for this. It's supposed to be nice and clear, like water almost. If you do see anything like that, it could indicate that either the bag was contaminated or it's expired, which is also why you need to double check the expiration date. And everything looks good for this particular bag.
Oh, great.
Yep.
Okay.
So I'm going to go ahead and hang it.
It's a better treatment option for those type of bacteria.
Alright, and now since it's going to be our primary infusion, we're going to go ahead and hang it on this loop. So I always like to just hook that up first, just to kind of get this loop out of the way.
Oh, okay.
Yeah, when you're hanging the primary, it's going to be a little bit lower than your piggyback, and that's just so the gravity will help have the piggyback go down.
Oh, wow. Okay.
I know, it's cool, right? And you have this really fancy Alaris pump, so that's going to help everything go in as well.
Okay.
Yeah. So for this, you want to remember that this is sort of a sterile procedure. Everything else on the bag is not sterile, but this particular spike in its lovely cap is sterile, and then the tubing right here is also sterile. So you want to make sure that you don't touch it or get anything on it, because it's going directly into the bag, and then all that fluid's going directly into your client or your patient's bloodstream. So
Okay.
you want to make sure that you keep it all sterile.
Okay, great.
Yep. And the easiest way to do it, I found, is just to spike it when it's laying flat.
Okay.
Some people like to hang it and then try to spike up like that, but that is hard for me, not just because I'm short. I don't know.
Okay.
All right, so we're going to go ahead and spike it. So you take your blue cap off, and you make sure you don't touch anything.
Read the stream, read the stream.
And you just go straight in. And when you go straight in, you want to make sure you're not going to the sides, because I've never seen it happen, but I've heard that you could actually spike right through this tubing.
Oh, wow.
Yeah,
Okay.
and then everything's contaminated, and you have to start all over again.
Yeah, that would not be good.
No, starting over again is never an option. So I know I already told you to do this earlier, but you want to make sure that all of your tubing is closed before you start hanging things, otherwise it's going to go all on the floor.
Okay.
Yeah, it's no good. All right, so we got the first one spiked. I'm going to go ahead and hang this. And did you have any questions for me?
No.
While I'm hanging stuff? No? You're good?
Just watching.
All righty. There we go. Gravity.
Well, I'll say that's our next patient. I'll give it a dry run.
Okay. And then I always like to
Dry the off.
squeeze, make sure the chamber's about half full. And that way you can still count the drips as they happen. And I like to go ahead and, I'm sorry, there's just so many things in the way. I like to go ahead and prime everything before I get it plugged into the Alaris machine. So the best way to do it, and since it has all this lovely new tubing, is that you just go over to your nearest trash can.
Okay.
And you just open up your gauge. And you want to make sure everything's open. Okay, so you can just sort of watch all the little bubbles get out.
See what happens. Like to exit out.
Okay, so you just want to make sure that all the bubbles get out of the tubing, because the last thing you want is a giant pocket of air going directly into your patient's bloodstream.
That would be bad.
Yeah, and then also, if you don't get all the air bubbles out, your Alaris pump's going to beep at you forever and a day.
Okay.
And as much fun as coming into the room every 5 seconds to fix the bubbles in the tubing is, I think that, as a nurse, there are a lot of patients that we're taking care of, so we can't always be with one patient, unfortunately. Okay, so we've gotten all of the air out. We've reclamped it so we don't dump fluid all over the floor. We're going to go ahead and turn our system on. It's going to turn on for me. Okay, excellent. And so now I'm just going to quickly double check to make sure I'm setting it to the right setting. It's going to be at 125 milliliters per hour, continuous. Okay, yep. Double checking that I am hanging the right one. Potassium chloride, 20 milliliters. Okay, good. All right, so we're going to go ahead and you are still on the med-surg floor. Okay, and then you enter in your patient's ID. Okay. Okay. Okay, and then we enter in the rate, and the rate was 925. Just making sure we're doing it. And it's still normal saline with potassium chloride. And then for the volume to be infused, I like to set it to slightly lower than our 1,000 milligram bag, or milliliter, sorry. So I always set it to 950 just so you get an alert before you completely run out of fluid. And that way you can kind of prep your supplies, and that way there's not that much of an interruption between the medication administration, between bags. Yeah. So I always like to do that. And then we go in, and we go and set it.
Make sure I have it right.
Okay. And then when you're closing this, you want to make sure that it closes pretty much on its own. And if not, it could be that you put it in wrong. So let's just double check that. Okay. Excellent. There we go. Okay. Alright, so now before we go and we hook this IV up to our patient, we want to go ahead and make sure that the current IV site is patent.
Okay.
So the best way to do that is to get an IV flash. And I'm going to get an alcohol wipe. And what you want to do is you want to inspect your IV site. So we're looking at it. Do you have any tenderness? Nope. Nope. You don't feel any warmth, anything out of the ordinary in your IV site? No. Okay. And so now what we're going to do, you just want to look for signs of infection and infiltration.
Okay.
So now we go ahead and we're going to get this port and clean it like we mean it. And there's going to be this lovely cap on there. So you can take the cap off.
Okay.
So you never want to leave a port open, because if you leave a port open, that's like leaving the body directly open to infection.
Oh, wow. Okay.
So you definitely want to clean it like you mean it after you take that cap off.
I've heard that.
Yeah, it's a very common saying among us nurses. All right, so I'm going to go ahead and hook you up, and I'm going to start infusing you with some normal saline. If you feel any discomfort at all, just let me know immediately, okay, Miss Yarn?
Okay.
So I'm going to go ahead. And you always want to make sure your channel's open, otherwise it's not going in. Any pain? Any discomfort? No? Okay, well it looks like that works just fine. So now we're going to go ahead and I'm going to toss this in the trash. Okay, so we're going to go ahead and hook you up. I'm going to get another alcohol wipe. I'm just going to clean it. Really, you can never clean IV sites too much.
Okay.
Just want to make sure everything is clean. Okay. Alright, so I'm going to go ahead and hook you up. Now that the line has been primed. Okay, and I'm going to go ahead and start the infusion. So if you notice any pain or discomfort when I start this, let me know. I'll stop it immediately, okay?
I will.
Or I could say, we're going to suck the back and ask it to do it. Would you like to spike it?
Okay. And then you're going to want to make sure that all your channels are open. Otherwise, it's going to tell you that there's an obstruction.
Okay.
Okay. Yep, it looks like everything is infusing. You're going to want to look for the first couple drops. So you just watch it. Okay, and you can see the drops are going. That means that it's actually being pumped through the lines.
Okay.
Yeah, so those are things that you definitely want to watch for when you're giving IV medication.
Okay, great.
All right, I've got that first one hung. Okay.
I don't want to be biting this with my teeth in the video, so I'm going to pre-open some.
And then you just want to put in your notes after you give a medication. Make sure you put in the notes in the patient's room so you don't forget later.
Okay.
How's that infusion feeling, Miss Yarn? Still okay?
It's fine.
Okay, excellent.
Oh, never mind. Oh, yeah. Okay. This will be easy. We'll just say. Ready?
All right, so now we're going to go ahead and hook up the piggyback. And that's going to be our gentamicin.
The antibiotic?
Yes, the antibiotic. Okay, so it's going to be the same thing. You definitely want to make sure you're giving the right medication, that it's the right concentration, it's not expired, looks nice and clear.
Okay.
Alright, and then Miss Yarn, can you go ahead and tell me your name and age one more time?
Martha Yarn, and I'm 80 years old.
Alright, any allergies I should be aware of?
None that I'm aware of.
Okay, excellent. Alright. Alright, so we give a piggyback every 8 hours. Alright, and then just remember what I told you about it having to be a sterile procedure. So you're going to want to make sure that it has that lovely blue cap there.
Okay.
Blocking it up, that you don't contaminate anything, don't touch anything that you're not supposed to.
Okay.
Okay, so you just hook it in. Alright. Okay, and then all your clamps are closed before you go ahead and pick it up. Otherwise, again, it's going to run all over the floor, which we definitely don't want. Okay, and then for this one, we're actually just going to hook it up to this port right here.
Okay.
And that way it'll get pumped through into our patient.
Okay.
So I'm going to go ahead and grab another alcohol wipe, because anytime you hook anything up to a port, you want to make sure you clean that port first.
Okay.
Okay, and then Miss Marta, while I have you here, we're giving you the gentamicin, as I said, because you have that infection, you have the bacterial infection. So ways to tell that you have an infection are if you take your temperature at home and your temperature is anything above 98.6, so if it's like 99, 100, 101, that could indicate that you do have an infection. You're also going to want to monitor your wound. I know you've been a little anxious about your cerebral ulcer. So if you see any redness, if you feel any heat coming from that area, that could be an indication that there's an infection going on as well.
Okay.
Yeah. I know that you have a history of pneumonia, so you should be somewhat familiar with the respiratory infections.
Yeah.
Yeah, unfortunately. So you're kind of familiar with those aspects,
I am.
right?
Sodium chloride with potassium.
With this lovely new IV, you also want to make sure you try it. So, just want to open up that port super quick. Alright, and now we're going to clean it like we mean it one more time. Thought I got all the air bubbles out, but I hadn't.
Our labs, pretty much came back normal. Had some protein in her urine. TMP,
We're going to open up the port one more time. And we're going to put in the setting for another IV. So you go to secondary, and you're going to want to select your drug. That's every 8 hours. Okay, and then we're going to double check and make sure we're doing the right amount.
And then she has other normal labs, phosphate, INR, BT as well.
Okay, so it looks like we're going to do 80 milligrams over 100 milliliters. That's what I thought, but I just wanted to be sure. Okay.
I have a few questions. Why specifically is this client receiving this medication, and what actual medication is it?
Is this correct dose?
Yes,
it is.
You do a lot further.
So it's basically going to act as a to inhibit the
And when should you question administering
Okay, so now you just wait to make sure that your piggyback that you just hooked up, you want to start seeing the drops go down. And then you can see that it's pulling directly from the piggyback. So you see how this one has some drops in the chamber?
Oh, yeah.
Yeah, and you're going to want to make sure your chamber's a little bit more full than that. There we go. Okay, so you'll see that the drops are coming from here. And then you'll notice that the drops have stopped coming from here, and that just means that it's pulling primarily from the gentamicin bag, not from the sodium chloride with potassium chloride.
Oh, great. Okay.
Yeah. Okay, so we're just going to go ahead and let that run, and I'm going to go ahead and document almost that we gave the medication.
You also want to check her
Alright.
alertness, make sure she's alert.
I'm just going to need to scan your wristband one more time.
I'm going to try to go through
And then we'll go ahead and scan this one more time. I've got to hit save.
Okay.
There we go. Okay, looks like it's correct. And the administration time.
Reactions like their possible symptoms with side effects like nausea, vomiting, rash, as well as we need to make sure that any changes of hearing, as I mentioned before, possible diarrhea, headache. We also want to make sure safely we're administering this medication, right patient, right dose, right time, and patient does have a right to receive this medication. And as far as home, patients should not be taking this medication at home because it is IV unless she is with home health and then administering this at home. So they'll have their own policies and take precautions.
Are there any other side effects and adverse reactions we didn't mention already?
No, so basically the confusion, the dizziness, the changes of hearing, allergic reactions, of course.
Okay, and then Ms. Marta, with the gentamicin, if you start getting any itchiness, any shortness of breath, anything feels out of the ordinary, definitely hit your call light and let me know.
Okay.
That could be a sign that you might have a sensitivity to the medication, so we want to make sure that we're taking you off of that as soon as possible if you are having a reaction.
All right.
Okay, so I'm going to go ahead and give you your call light. This is your call light.
Thank you.
You're welcome. So that, just remember to hit that anytime you have medication questions, problems.
Okay.
Yep. And then also, I know you had some questions about your surgical debridement tomorrow.
Yeah.
Yeah, pretty much what that entails is they're going to go in and they're going to surgically remove all the necrotic tissue from your sacral ulcer. And things to keep in mind after your procedure are things like you're going to want to monitor the site for infection. We'll be doing that here, though.
Okay.
We'll also be taking care of your bandage changes. So
Okay.
we'll be able to help you monitor. But if you feel any heat, burning sensation, excessive pain, anything like that, definitely let myself or whoever your nurse is next shift know.
All right.
Okay. And then also,
Hang the fluids.
signs of infection, you're going to want to make sure that you can communicate with us using the, remember that scale I asked you about, the 0 to 10 pain scale?
Yeah.
You're going to want to be able to tell us how intense your pain is based off of that scale, just because if the medication that we're giving you to help control the pain isn't working, you're going to want to definitely let us know, because that could mean something's wrong or that you're not getting enough pain coverage.
All right.
So either way, we need to be able to know right away so we can help you out with that.
I'll be sure to keep you informed.
Yeah, because the last thing we want is to have you in an excessive amount of pain.
I don't want that either.
Yeah. So we're going to let this go, and we're going to monitor you. Let's see, the last one was about, I'm just going to quickly take a look and see what our next vital sign is.
Go ahead and flush your IV to make sure that it is working.
She's 5.
Okay, well actually I'm just going to come in and monitor in about 15 minutes. I'm going to come in and just take all of your vitals, just to make sure you're not having any adverse reactions. If you notice anything between when I leave and when I come in to get your vitals checked, definitely hit your call light immediately. But I'll be back in about 15 minutes to do your vital signs, and we're just going to monitor your temperature to see if that starts going down into a normal range again. We want it to be about 98.6. So if we see any indications that your temperature is going down, that'll mean the gentamicin is having an effect and it's helping with your bacterial infection.
Okay.
Okay?
Sounds good.
All righty. So let me go ahead.
Anyway, I'm sorry. Hi, hang up your...
Hi there, are you Terry?
So, the reason why we're giving you these, is the IV.
And is there anything else I can get for you?
No, I think I'm okay for now.
All righty. Well, if you want a snack or some water later, let me know, because remember, you're NPO at midnight, so you can't have anything after midnight.
I'll remember.
All righty. Thanks for letting me have a level 1 student with me.
Thank you.
Okay.
Okay, I have some other questions for you, if I can.
Yeah, sure.
Were there any pertinent pieces of information you reviewed before administering the medication?
Well, as I said, the things that you want to look out for are signs of kidney disease, kidney failure. So we reviewed all of her lab values for that, the BUNs, creatinine, all that stuff. And she was within the expected range, the normal expected range. So that means she wasn't experiencing any kidney failure. So that. And we also double-checked that she was actually, the culture came back with gram-negative bacteria, because gentamicin itself is actually very specific to gram-negative bacteria. So had it been gram-positive, the gentamicin won't work. So then we'd have to call the physician and just double-check with them to see why they gave the gentamicin.
Okay, so that information would affect your decision to administer it.
Right. We also checked the patency of the IV site, because if the IV site wasn't patent, if there was some infection or infiltration, then we would want to discontinue that IV site and start up a new IV. But since it was patent, we were able to give the medication through that site.
Okay. Did this information affect how you administered it?
Not Not really. It's a standard IV infusion, so it didn't really change how I would give the medication, other than just making sure everything was patent and that we could still give it in that particular site.
Okay, great. I think that's all. Those are all the questions I have.
Okay, sounds good.
Okay, thank you for letting me join you
Oh,
today.
you're welcome.
Okay.